Today we're going to be testing hip internal rotation active range of motion. Begin by making sure the subject is seated on a supported surface with the knees flexed to 90 degrees over the edge of the surface. Place the hip in 0 degrees of abduction and adduction and in 90 degrees of flexion. Place a towel roll under the distal end of the femur to maintain the femur in a horizontal plane. Place one hand at the distal femur to provide stabilization and use the other hand at the distal tibia to move the leg laterally. The hand performing the motion also holds the lower leg in a neutral position to prevent rotation at the knee joint. End of the range of motion occurs when attempts at resistance are felt and attempts at further motion cause tilting of the pelvis or lateral flexion of the trunk. Before taking an active range of motion measurement, begin by checking passive range of motion. Center fulcrum of the goniometer over the anterior aspect of the patella. Align proximal arm so that it is perpendicular to the floor or parallel to the supporting surface. Align distal arm with the anterior midline of the lower leg using the crest of the tibia and a point midway between the two malleoli for reference. Take a starting measurement to make sure the patient begins in a neutral position. The patient will now actively demonstrate hip internal rotation. Measure the patient's end range. Normal active hip internal rotation range of motion should be 45 degrees.
She is 41.